Hey, welcome back to the Dr. Jim Cares podcast. My name is Dr. Augustine from Head to Wellness, and today in this episode, we're going to be doing something a bit different. We're going to be doing some case studies. We're going to look at some actual real patients' case studies, again, to demonstrate the approach, what they were dealing with, plus the approach to their problems, my approach. And then, of course, this is why we get the results, the kind of results that we do with patients. So let's get started. Now, here's the framework that we're going to look at. So the patient's life story, their symptomatic, their chronology of their symptoms, how complex their condition really is, and then we're going to look at the holistic approach, my specific or unique approach to how we're going to help these people heal, not treat. We're going to talk about diagnostics, the testing that we need to figure out the root cause of their problems, the healing process, and we're going to compare our approach to the conventional healthcare approach. And this, of course, the patient outcome. And hopefully we'll get through two of them. We'll try. We'll see how we do. And of course, follow up and future plans for these particular patients. So let's get started. So patient number one is Wendy. Wendy is a 55-year-old female. She came in complaining of body aches, constant body aches for a year. Body aches were in her hands, in her shoulders, in her back, in her lower back, as well as her lower neck. She had tiredness and fatigue for an entire year that was just constant. She gets off work at 5:30 and then she's literally just done after making dinner. Her sleep, she gets to bed, she starts to go to bed at 8 o'clock at night. And she's up at 5 or 6, but the problem is she wakes up during the night at least twice. Stress, not so bad, but some stress. Her blood sugar was a problem. Her doctor had told her that based on recent blood work that she's pre-diabetic. And her cholesterol was 250. Brain, intermittent mental acuity issues. So memory, focus, concentration, intellect, how that all works. So basically brain fog. Also, her immune system seems to be down and pretty low because she always gets sick. She's currently, recently not seeing many other doctors at all, so she has other concerns for the future. Like, what are her future concerns that she's worried about? Of course, energy, because energy seems to be a problem anyway. She feels like she's getting old, which isn't good. Her gut health, digestive health, her ability to handle stress, because she can't do it so well right now. Also concerned about her thyroid function. She wants to also be able to control inflammation in her body. Her immune system is a big concern because she always seems to get sick. Hormone balance, menopausal symptoms such as hot flashes. Brain health for the future because it's starting to degrade as well right now. And her overall sense of well-being. And so we did, as far as now the process, obviously this is a full body condition. There's a lot of systems involved with this. And so we then did and chose to do after our consultation, we started to talk about, okay, so what type of strategies do we need to use to figure out what's causing these issues? So we chose a testing that's called the Menoscan Pro. I like to call it the full body scanning technology. It's not an x-ray or an imaging scan of organ systems, but it's actually measuring how these organ systems are functioning, and it does it very non-invasively. So it's a beautiful test, kind of showing a little bit about everything going on inside the body. Love this process. So after that, we sat down, we did the report of findings to explain what we found. And that was a good 45-minute process because it's not only here's what's bad and what's wrong, but it'd be terrible if that's all I told her. But then, okay, what's the strategy to solve these issues? And the strategy has to make sense to her, the person, the client, the patient, because we've got to be able to connect the dots. Because if you can't demonstrate how we're going to make a common sense approach to solving these problems, if it doesn't make sense to her, certainly she's going to go, no, I don't know. I don't really think that this is going to help. Of course it did, because I painstakingly take the time to make sure it does, because we found the root cause behind it. So in this particular patient's case, she was dealing with problems going on within her autonomic nervous system. So let me tell you my approach. It's a multi what? It's a multiple, say, lifestyle approach. So first and foremost, central nervous system, a special part of your brain, central nervous system called the autonomic nervous system. Now this is the approach that so that we can get people to heal. Autonomic nervous system, what I've discovered in 27 years of doing a particular type of test, it's called heart rate variability. We did this with this particular patient to measure and see not only heart function, but most importantly, how the autonomic nervous system is doing, which is that special part of your brain that automatically runs and regulates your organ systems. So what I've discovered is people that the more chronic and problematic the illness is, the more problems going on in the body, the more problematic their nervous system is. Conversely, what I've discovered that people that have great health have great autonomic nervous system function. So there has to be a connection there. So what if we could take these people that have chronic, dreadful illnesses and we can do something about what cures, treats, and heals them? Not me. I do not cure, treat, or heal anyone. It's completely up to the person's autonomic nervous system. So if we can do something for that, which we did, to improve it, and she did have problems within the autonomic nervous system. And by the way, just to let you know what the autonomic nervous system is, there's two parts to it. There's the sympathetic and the parasympathetic. The sympathetic is the fight or flight side, which maybe you've heard about. It's what most people are dealing with today when they just drive on the freeway. Boom, you're into that sympathetic stress mode. Increased heart rate, increased blood pressure, stress. But the rest and digest parasympathetic is a really calmative, relaxing, decreased heart rate, decreased blood pressure, healing side of the nervous system. Now, both of them are always involved, and what we found is the parasympathetic is always low. Now, how low will also correlate with how significant a person's illnesses are. Plus, their sympathetic tends to be too high. This fight or flight system tends to be too high. There's also an enteric part of the autonomic nervous system, and that means there's a gut digestive part as well. So we found this person had problems, significant problems in the autonomic nervous system, pretty much in a severe range, severe nerve system problems. They had problems, this person had problems in their digestive tract, this person had problems in their liver, certainly in their pancreas and blood sugar, we found that. Their adrenal glands were really problematic. So there's different aspects of the stress that goes on in our body. And everybody has stress. But what controls stress and deals with stress and adapts your body to be able to handle stress would be the adrenal glands that sit on top of your kidneys. Her adrenal glands were terrible. Matter of fact, there's a range of testing. She was below the range. She wasn't even into the normal range. It wasn't too high. She was actually way below. So we'll talk more about that. Her cardiovascular system was involved, meaning that usually heart doesn't cause heart problems. It's always something else that causes it. So if we can do something to find what that something else is, then automatically in a nice way, heart has a tendency to come back into balance, which is another great reflection of how a person's doing. Yes, sometimes there is heart disease. Heart disease can actually, we could try to get people to heal from those situations as well. So I can talk more about that later, but let's talk about this particular patient. So 6 weeks of this care that we do, and the care is, like I said, there's several aspects to it. We do something to improve the autonomic nervous system, and that something is biocranial, something that I do by hand with the patients laying on the table. And there's this really nice but very deep stretch up into a very precise muscle that attaches to the back of the skull. We do it on both sides because you have two hemispheres in the brain. So in doing that, actually will improve a person's autonomic nervous system function. With the second part of that, and this is something that else that we do with patients, is we provide something that's called high voltage pulsed electromagnetic fields, high voltage PEMF, to all the various different organ systems in the body that are struggling and having problems. Then we also talk about dietary changes. Diet is critical. Let's just say you have a fire going on inside your body, which is the problems. And the fuel to the fire can be the food that a person's eating. So if we can do something to improve that, to change that, to take the fuel away from the fire, then the fire can go out, especially when it comes to a person's blood sugar. Because blood sugar problems, whether it's pre-diabetic or diabetic, destroy a person's heart and blood vessels. Hence the number one reason that heart disease in this country is the number one killer still. So we need to do something dietarily, really critical, really foundational. And as we're talking about these items and this approach, some people are saying, no, you know what, that's too much work. And I would have to say to that very strongly and honestly, I can't work with people that are not willing to change their lifestyle, because the root causes of most illnesses are in the lifestyle. One aspect of lifestyle is sleep. So what if a person's adrenal glands are just lit up to the point where there's no way they can sleep because their cortisol's too high, their adrenaline's too high, which we can see in the testing that we do. There's no way you can sleep. So we have to do things to improve that, because you heal when you sleep. So let's talk about this. We changed diet. We also had this patient do a little bit of exercise, meaning take some walks. Just get out in the sunshine. Just some breathing, some fresh air, not running, not race walking, just move their body daily. Good things. We talked more and more about diet and things of that sort. There's also some nutrition that's involved with what we do. So taking a combination of whole food nutrition and herbs. Why do we do that? Is because your biochemistry, her biochemistry, is based on nutrients. So providing back what's missing to balance her biochemistry out makes a massive difference as well. So this is the approach that we took. So literally 6 weeks later, 6 weeks, mind you, her wellness score from this particular scanning technology went from a 236. The best it can be is 500. And usually like 420 up to 500 is reserved for elite athletes, but was a 236, so pretty significant issues. Went all the way up to 339 in 6 weeks. Sympathetic nerve system improved, came down. Parasympathetic nerve system came up. Microcirculation, small tiny blood vessels that really bring nutrient and oxygen to our tissues and cells. Cardiovascular marker, right? But it's actually a very specific marker that also helps us to know about blood sugar problems. So that went from a 50 up to a 79. On the scale, 0 to 100. So 100 would be best, but you went from a 50 up to a 79. Great change. Cardiovascular score went up from a 44 up to a 56. So that's moving up in the right direction. Because people can have chronic blood sugar problems, but just prediabetes. And they don't pay much attention to that because they're not full-blown diabetes. But let me tell you, prediabetes can cause very significant damage to your heart and blood vessels, just like diabetes can. So need to solve that. And that's what I'm saying, very critical dietary change. There are some other nutrients that really will help balance out and strengthen and support your pancreas and your liver and the adrenals, which are the three systems really to stabilize blood sugar. So her physiologic score went from a 19 up to a 20, which is significant because this scoring only goes up to a 31. And that particular score, physiological score, takes into account some very major systems that are going on in the body. So good change there. Her autonomic nervous system score went from a 30, really low, up to a 90. Almost perfect. Body fat dropped from 39 down to about 37. Systemic vascular resistance, the overall tightness or tone of her blood vessels, more relaxed. That's better. Heart rate came down. Blood volume improved. There was an imbalance in blood volume. SDNN, now we're getting into the autonomic nervous system, pieces of heart rate variability testing. So SDNN is a measure of the overall health of a person's autonomic nervous system. Came back into normal balance. RMSSD is a measure of the overall health of a person's parasympathetic, because that's the critical key to bring that up and forward so people heal. That actually balanced out very nicely as well. Stress index, has to do with heart work and oxygen demand. That was better. Power low frequency, another way to measure the autonomic nervous system. Power LF, low frequency. Sympathetic nervous system, that actually came down into normal range. Parasympathetic is called power high frequency. That came up into normal range. So really, really good changes here. Her beta cell function. Beta cells are the cells in your pancreas that produce the insulin. That came into balance as well. GABA, which is a brain chemical neurotransmitter that tends to be calmative. People will take GABA as a supplement to try to calm themselves to sleep. Well, her GABA balanced because we did a lot of work on her gut. You make 95% of your brain chemicals in your digestive tract. So we've been working on the gut, helps to balance brain chemicals. So that was spectacular. Her lifestyle score went from a 23 up to a 26. Again, that score also only goes up to a 31. So great, great changes there. Organ systems themselves. Small intestines improved because we worked on her gut. Brain improved. Adrenaline went from a 17, remember I was telling you how low it was, 17 up to a 45. So interesting, this patient's question results. Like we asked her, so how'd you do? And she is literally, this person came into me so excited about her care. She really needed to change. She really wanted her body to improve and heal. Oh my goodness, what kind of changes this person made. So she was fully on board. And I have to say, very, very significant point here is that if people will just do what I tell them to do, they're going to get phenomenal results. I'm pausing here because it's so significant. If they will just listen and do what I tell them to do, of course, this is a partnership. This is a team effort. They're going to get phenomenal results. Have to. And this is the way it truly works. It's the person that only does a little bit, doesn't change their diet, won't take their nutrients, skips visits, doesn't come in. Results drop tremendously. This lady was fully on board and she got such a boatload of changes. Some other testing. SATP, it's a very sensitive marker for prediabetes, went from a 541.9, so 542, down to a 473.3. The goal is less than 377 on that particular marker. That would mean that she's not pre-diabetic anymore. So great improvement there. As far as heart function, left ventricular ejection time, that improved. Systolic time, heart function, the strength of her heart also improved. Blood pressure went from a 134 over 94 down to a 121 over 81, like almost a perfect score. Under the testing called heart rate variability, like I said, parasympathetic came up, sympathetic stress nervous system came down. Phenomenal. This person has boundless energy now. She gets up early and she goes to bed now 10:30, 11 o'clock at night with energy all the way up until she goes to bed. She sleeps better and longer, doesn't get up in the middle of the night, wakes up refreshed, and she's so happy and excited. And oh, by the way, her joint pain and her body pain gone. So she's really, really, really excited about her results. So I want to say, if you need any help with your current health problems or conditions, please let me know. I'm on email, draugustine@gmail.com. You can call my office at 562-860-3404. I'm also on social media. So I'd love it if you give me a like and maybe subscribe to my channel, because I'm on Instagram, I'm on TikTok as well as YouTube. I'm also doing podcasting, Apple Podcast, Google Podcast, and Spotify as well. And please subscribe to me there, because again, I want to provide useful and good information for you. My name is Dr. Augustine. I hope this helps. Please let me know. Leave some comments for me, and we will see you next week.